Hey y'all, it's Erin, aka Grishno, and transgender healthcare is hard. It's a difficult thing to deal with, and it's something that we all have to go through. Whether it's just getting an annual checkup, uh, specific needs around like gynecology or reproductive health, or just accessing basics like hormone replacement therapy, which is something that almost every transgender person goes through at some point. It's hard. Oftentimes we have to act as our own advocates. We're the one with knowledge in the room, and that's so backwards from what it should be when you're with a doctor. They're the expert. They're the medical opinion. I shouldn't know more about my health than my doctor knows. But that is a reality that happens sometimes. So I wanted to come on today and talk a little bit about transgender healthcare and what my experience has been with it so far. So when I first started my transition, which was many years ago, I was living in the middle of Utah, and the doctor that I was going to had never met somebody and never had a patient or anything like that who was trans. I asked about hormones, and they said that they weren't comfortable doing it, that they didn't have any knowledge, they didn't know what to do, and so just said that they wouldn't do it, but recommended I find a therapist and that maybe they could send me to somebody. So as a result of that, I ended up going online and finding hormones online. I was able to order them through an online pharmacy, and they came right to my door. Um, and I did it without any medical oversight, and it was bad. It was not good. I didn't understand that I needed to block the testosterone that my body was making, so I wasn't taking anti-androgens like Spiro or spironolactone. I didn't know like how much estrogen I should be taking. I was just sort of guessing from these online guides, so I was taking a bunch at the same time that I wasn't blocking my testosterone, and so I just had like so many hormones in my body. At the same time, I was also a smoker. I smoked cigarettes at the time, and if anyone knows, like smoking and estrogen are just like they don't mix. It's the oil and water sort of thing, but it's like the fast track to a heart attack. And one day I was riding my bike, and I started getting these shooting pains across my chest, going up to my shoulder, and that's what they say is what it feels like when you're having a heart attack. And it was so bad, like I couldn't stand up straight. It just hurt. It hurt so bad. And so I went to the hospital. And the only way I could get around was on my bike. So I'm like, just like dying on my bike. And I get there and I walk in. I'm in so much pain. And the lady asks, are you taking any medication? I say, I'm taking estrogen. And she says, do you smoke? And I say, yeah. And she says, have a seat. And I sit there for 40 minutes. And by that time, the pain's gone away. I don't have insurance. I don't have any insurance, I think, at this point. So everything was out of pocket. And I was like, you know what? I'm done. It's not hurting right now. I'm going home. Like that was what healthcare was for me. And then I moved to New York, and I found a doctor. I went to Lion Martin in New York City, and I went in on my first visit, and I'm like, I've been taking hormones for like 6 months at this point, and this happened in Utah. I went to the hospital, and they were like, this is awful, stop. And I had to go off hormones. They got my basic blood levels done, and then they got me on hormones right away. And they also got me on blockers, and they were able to hook me up with discounts on my prescriptions and all these wonderful things. And they knew how to work with trans people. They actually had a specialty in this, and it was amazing. It was like night and day. And then I moved to California, and I really wanted to find a similar sort of experience where I knew a doctor that I was going to was competent and knew how to handle my body and my needs as a trans person. And so I went online and I Googled, or I think I went to Yelp actually, and I Googled trans-friendly doctors. And I got 3 results that popped up. One was a vet. One was a pharmacy that had a review that said, if you're transgender, don't go here. Don't do it. Like they, disrespected me, and all this is what happens, is my story. And then the other one was a doctor that said that they were LGBT friendly, but they didn't have anything specifically about trans. Um, so I went through them, and I asked them if they'd actually ever worked with anyone who was trans, and they had worked with several trans men, but never a trans woman. So I went in, and it was amazing. The nurse practitioner that I saw actually researched before I came in what to do with trans women. So she knew about hormones. She knew about all these different things. And even though you know, we had some things that we had to learn together about, like, you know, what are my gynecological needs now that I'm post-op? Like, what sort of care do I need down there? You know, like, how do you do different STD screenings, like HPV, for example? Like, it's very difficult to do any sort of screenings for that for trans women because we don't have a cervix. So like different things, but like I loved going to her. I did, because every time I went, like, she just made me feel so happy, so wonderful. Like, I, as a trans person, am not used to leaving the doctor happy. I'm used to leaving the doctor and feeling defeated. And this was a new experience. It was amazing. Like, she would always make comments about, oh, you're just like any other girl. You're just this, you're that. Like, you think you're all special. You're not. Like, and it was just like so affirming to just like, just be normal. Just feel normal when I'm with the doctor. So recently, Morgan got a new job. And with that, that means that we had to transition healthcare. So um, we don't have an HMO anymore. We have Kaiser. And you know, Kaiser has a reputation for being pretty trans friendly. They cover a lot of surgeries for trans people, but everything's sort of within their network, and they have like a trans specialty unit of doctors who are knowledgeable about trans issues, and any physician has access to those doctors and can talk to them. So I set up an appointment with my first doctor, and I let her know. I wrote her a little letter ahead of time saying, here are my needs, here's what we've been doing for the last several years to sort of keep me on track and make sure that I'm healthy. And I went in yesterday because I needed to fill out this form for the DMV. And at some point she's like, okay, you know, we should do some labs, we should do some blood labs. And she's doing like cholesterol and you know, all the different things that you do, and she doesn't include any labs for hormone levels. And I asked him, like, oh, shouldn't you also be monitoring my hormone levels? That's what my last doctor was doing. And she was like, oh, you know, I don't know, you know. And so she had to go and look into it. And I'm sad. I'm sad about it. It's like I had this doctor that I loved, and then it never happened. Like, I never had the experience of leaving the doctor happy. And then I had it, and it was wonderful. It was so good. And now I left the doctor, and I felt like I was the expert again. I felt like I had to teach her about my needs. I felt like she didn't know how to handle me, and it's not hard. Hormone replacement therapy is not unique to trans women. This isn't something that we just do just for trans people. Other people go through this. It was, I don't know, it's so hard. Healthcare is something that, as a trans person, it's always up in the air whether it's going to be an issue or not. Like, finding a new doctor as a trans person is so stressful, and I know that this is stressful for anybody. Like, changing healthcare providers can be hard, but there's an extra layer, I think, for trans people that cisgender people just don't have to face. And it's been up and down, up and down. And so I wanted to come on and sort of share my experience with healthcare and what it's been like for me. But I would also love to hear what your experience has been like. Have you been able to find doctors that make you happy? Are you often the expert in the room when you're with your doctor? Like, what's going on? What's your experience as a trans person getting health care? Let me know in the comments below, because I'd love to have a conversation about this. If you like this video, feel free to give it a like. It really helps out with people finding the video, people being able to see the conversations that we're having. And if you'd like to see more from my channel, feel free to hit the subscribe button. I make new videos every Friday, and a couple more throughout the week that are usually live and things like this. So hopefully I'll be able to see you soon. And until next time, I'm Grishno, and I'll see you later.